For our total patient population, we enrolled 56 patients. One thing that's very striking about our study is that this was a very heavily pretreated patient population. And if you compare this to other studies of R-squared, such as the Augment study, our patient population had a median of 3 prior lines of therapy. 50% of them were considered refractory to their most recent line of therapy. And 25% of them were positive for POD24, which means they had relapsed within 2 years of their initial chemotherapy, which is an independent negative prognostic factor. So we really had a very heavily pretreated, high-risk patient population. Of the 56 patients, 10 were treated in dose escalation and the remainder were treated in dose expansion. And of the 10 treated in dose escalation, there were 6 patients who were evaluable treated at the RP2D. We ended up with 39 efficacy evaluable patients. We found that our therapy was extremely well tolerated. Although myelosuppression was a common toxicity, and 50% of our patients had grade 3 or 4 myelosuppression, with growth factor support, most patients were able to continue on therapy. And this was primarily neutropenia. Thrombocytopenia and anemia had a much lower incidence. There was an 11% incidence of neutropenic fever, and we feel that this is probably because the patient population had been so heavily pretreated. But only 30% of patients required dose modifications or dose discontinuations, and 30% of patients came off study at some point due to myelosuppression.